Hello, I'm Nancy Fulveri Schaefer. I'm a professor of neurology at Cleveland Clinic Lerner College of Medicine, and I practice sleep medicine and epilepsy medicine. What is narcolepsy? Narcolepsy is both a neurological disorder and a sleep disorder that is characterized predominantly by excessive daytime sleepiness, despite having an adequate opportunity to sleep at night. What causes narcolepsy? Narcolepsy type 1 is characterized by a loss of orexin or hypocretin, which is a neuropeptide in the brain that is important to maintain wakefulness and then be able to stay asleep. So we believe that people with narcolepsy type 1 might have had a damage to the neurons in the brain that release hypocretin. Now, on the other hand, narcolepsy type 2 is very similar in some ways to narcolepsy type 1, but we do not understand the neurobiology of it. In patients who have stroke in a certain part of the brain, multiple sclerosis affecting a certain part of the brain, or even a head trauma, they would have dysfunction in a certain part of the brain that controls REM sleep. And that can lead to what we call secondary narcolepsy, a disorder of narcolepsy caused directly by something that affected the pathways in the brain that control these sleep and wake pathways that are critical to establishing sleep and wakefulness. What are the 5 signs of narcolepsy? CHESS is an acronym that stands for cataplexy, hallucinations, excessive daytime sleepiness, sleep paralysis, and disturbed night sleep. And these are the 5 features that are variably present in people with narcolepsy. Cataplexy is this sudden muscle weakness triggered by emotion that we will only see in patients with narcolepsy type 1. And some of them have had such mild cataplexy that they don't recognize it. That's triggered by an emotional stimulus, and it's usually something positive, like laughter or joking. And people with narcolepsy will have like a little head drop, or they may drop something that they're holding, or they may buckle at the knees or completely fall. Sleep-related hallucinations happen at sleep onset as we're transitioning to sleep and as we're coming out of sleep, and they can even happen around naps during the day. They can be visual, they can be auditory, hearing something that's not there at night, and they can be tactile. The classic description of some patients would be, I'm in bed at night and I'm falling asleep and suddenly it feels like something's crawling on me. Or I open my eyes and I see a face in the distance, but I can't quite make it out. Or I'm hearing someone knock on the door, but there's no one really there knocking on the door. Many people, when they have sleep paralysis, which is this brief awakening from sleep with a sense of being paralyzed, because our muscles are paralyzed in REM sleep, very often at the time of paralysis, there's also a hallucination. Those two come together. Sleep paralysis can be terrifying, especially the first time. It may feel like all of your muscles are paralyzed and you can't even take a breath because really you don't have a lot of muscle control. You can open your eyes and look around, but cannot speak during sleep paralysis. Then we have disturbed nighttime sleep. Classically, people often think that narcoleptics are really sound sleepers, but the sleep time at night in narcolepsy is actually very disrupted. And so people wake up a lot when they have narcolepsy, and they may remember their dreams and they may dream very heavily. Can narcolepsy be cured? Narcolepsy can be treated, but we don't know of a cure for narcolepsy. However, there's a lot of active investigation in this area, and there may come a time when that will happen. For patients with narcolepsy type 1, their brains are deficient in orexin, and now we are studying in clinical trials drugs that are orexin agonists. They help boost orexin in the brain. So finally, we have drugs that are not on the market yet, but they're being investigated, and they show tremendous promise to actually treat the source of the problem, rather than how we've always treated this problem, which is using stimulants and wake-promoting medications that may treat the symptom to some degree, but don't get to the underlying cause or the underlying deficiency in the brain that's causing the disease.